Hi, Dr. Rob Carson. Thank you so much for being here today. You know I love talking to you and asking you nosy questions. So I'm really excited that you're going to be here today for an Angelman update. And for
Always, it's a pleasure.
good. For people who don't know what Angelman updates are, this is a production of both the Angelman Syndrome Foundation and the Foundation for Angelman Syndrome Therapeutics. And so both ASF and FAST want you to know what their researchers are doing and what's on the cutting edge. So I'm Dr. Jo Bichell. I am a neuroscientist and I'm the mother of a 22-year-old son with Angelman syndrome. And today I'm interviewing Dr. Rob Carson, and I'm going to have him introduce himself.
Hi, everybody. I'm Rob Carson. I'm an MD PhD. I'm a child neurologist by training. Also have a history of doing basic science research, and I now direct the Angelman Syndrome Clinic at Vanderbilt.
Fantastic. And you've become a real expert in Angelman syndrome, and you have been doing this now, Angelman research, either bench work or clinic work, for a long time now. If you add it all up, like 8 years, right?
Yeah, some of the basic science research started, using the mouse models many moons ago. On the clinical side, it's really been since 2018 when the ASF-funded clinic at Vanderbilt got up and running that I started as the epileptologist for the clinic. So, expert is a strong title. I'm working to live up to that, but I don't think we can ever know anything about everything.
So that right now you're both the epileptologist at the clinic and also the clinic director?
That is correct.
And
So,
you've
I'm sorry, go ahead.
no, sorry, I keep interrupting. And you've also been directing or you've been principal investigator in a bunch of different clinical trials too, I think.
Correct. So we've been involved in some of the OVID trials, the natural history trial based out of Boston, as well as then we'll be working with the ladder database that's both from the Angelman syndrome side of things and the Dup15q side of things, as well as I worked with Dr. Dewis on an investigator-initiated trial for exogenous ketones, which hopefully will be published soon.
That's good. People have been asking. And what about also the cerebrospinal fluid collection trial too? You're investigating that as well at Vanderbilt, right?
Correct. We're also part of the Biogen study, aiming to collect cerebrospinal fluid to look for biomarkers for Angelman syndrome.
Cool. So today I have you on, I think it was to talk about myoclonus in adults, but I'm not sure exactly what your project is. Would you mind talking about it?
Sure. We can talk about all sorts of things. So I think one of the things that we've identified in our patients is, well, the working term is myoclonus or non-epileptic myoclonus. And Ron Thiebert's really out of Boston has really done most of the work describing this. And it's really just, myoclonus is hard to mimic, but it's kind of a type of shaking with really abrupt, fast movements that, again, our muscles normally can't recreate. And this can be very disruptive to patients because you can imagine just with marked shaking, it's hard to do anything. It's hard to pick something up. It's hard to walk. And so it can really interfere with just its activities of daily living. Dr. Thiebert's data suggests it's really quite common in Angelman syndrome and gets more common as people get older. So this is definitely something that people may encounter. It can look like seizures. There's some overlap, which makes it somewhat challenging to both identify and kind of put in a nice area to say, oh, this is myoclonus and not epileptic or seizure type myoclonus. It's also hard to treat. We use a lot of medicines that are the same epilepsy seizure medicines that I use all the time, and many of them just aren't overly helpful. So it's definitely an area where we need better therapies.
So what's the difference between myoclonus and a seizure? If they're different, what's different about it?
So anything when we talk about seizures, it's triggered by the brain. So the outer part, the cortex of the brain, which is the area I think of, if you think like an orange, it's the rind, if you will. And it's something that if we have EEG electrodes on the head, we can say, oh yes, this is a seizure, and we can see the firing of the brain that goes along with the movement. We can also then have other types of what we call subcortical myoclonus, which is triggered from deeper structures within the brain that are harder to really study. There's just certain areas of the brain that we don't want to stick an electrode in because, well, it would be really bad. So it's something that it's a myoclonus, but it's not triggered from the brain itself.
So it's triggered by the muscles?
Well, I misspoke. It's not triggered by the cortex. So we think it's from likely deeper structures in the brain, and that's part of what led into the thinking of, do we need to think about this differently in terms of what it is, because that would change what drugs we use to treat it. So for example, there's many other movement disorders, for example, something like Parkinson's disease, or where people have a tremor that comes from the deeper structures within the brain. So given that information, is there a possibility that some components of non-epileptic myoclonus we need to think more about as a classic movement disorder and less about as more of a seizure-like entity?
So if it's a movement disorder, you're treating it with a totally different medication than if it's a seizure?
So yes, there's different classes of medicines that we use to treat seizures, and based on the mechanism of action of how the drug works, what it affects in the brain. And there's a whole different set of medicines that are often used by our movement disorder colleagues for treating different types of abnormal movements. Some of those medicines are things that are actually really kind of restricted, that even as a pediatric neurologist is not something I would routinely use, and it's only our movement disorder specialists routinely use.
Huh. And have those kind of medications been tried in people with Angelman syndrome yet?
It's possible. I'm not aware of in any sort of a regulated way. So there's lots, and this is one of the challenges we have, is there's lots of anecdotes of, oh, we use this medicine and it helped my child, or we use this supplement and it helped. But I'm not aware of a lot of trials bringing out some of these other medicines.
So how are you going to study this in people with Angelman syndrome?
So some of the impetus for the study that we start came from some of the movement disorders meetings, where you have a whole group of people together and you all watch the same video and people say what they think it is, and this is that, but that's not that, that's this. And obviously in the COVID world, and hopefully soon to be post-COVID world, it's hard to get 100 people in a room. But I also like simplicity. So the simple idea is to reach out to our families in the community and say, does your child have abnormal movements that are concerning? And especially ones that haven't responded to medicine. And are some of those non-epileptic myoclonus? So a lot of shaking. If so, you reach out to us, and this is going to be done through the latter database, which is getting rolled out through all of our Angelman syndrome clinics. Hopefully, as we get everything established, there'll be links on the Angelman syndrome website that basically says, if you're interested in this, go to this website. And the whole idea is that everything will be website driven. We'll have some survey questions, and then you will make videos of the movements you're worried about at home. So it's really straightforward. You know, we're going to give some advice on, hey, if you can capture, you know, maybe movements or eye movements or manipulating objects or walking, that's going to be extra helpful. But really, if you can make a short video that shows the movement that you're really worried about, you would send that in along with additional data. And then what our goal is we've set up a team of, I think now we have 14 movement disorder specialists. So a mix of adult and pediatric neurologists who focus on abnormal movements. And we will have them review all the videos and basically say, what would you call this? One of my hopes is the next step we might be able to do, and this is a little trickier, would be say, you know, if you saw this in your clinic, what are the top 3 medicines you might suggest to use? And my hope from that is not only will we be able to then kind of have a library of, here's this movement, we're going to call this non-epileptic myoclonus, and we can use these video examples to teach everyone, all of our other providers, so that, you know, where this becomes important is if we're doing future clinical trials, everybody is on the same page. This is what we're calling non-epileptic myoclonus. This is an example of tremor. And so we can kind of delineate these better. And I bring that up simply because in, you know, some of my experience, you know, where we focus and think about seizures a lot in clinical trials, but not so much non-epileptic myoclonus. So I think it's an important endpoint that we do need to consider going forward. So
1 second.
yes,
That's really cool. So basically what you're doing is making a video catalog to define all these different things that happen to people with Angelman syndrome. So then people would be able to look at those videos, doctors, families, pharmaceutical firms, and everybody could look at those and say, oh, okay, that's myoclonus, that's a seizure. This might be myoclonus, this might not, something like that, right?
correct. And you know, and that's, I think, the one part of all this that has me a little worried is that, you know, obviously if we're talking about using videos for people who participate, you know, there's some things we can kind of blur faces. Sometimes we can't completely blur out a video, otherwise it defeats the purpose. But so, you know, I know some families may have some privacy concerns. There won't, obviously, none of any clinical data will be linked to any videos. But, you know, I do think that as people see what we're trying to do, I think many members of the community will be comfortable with saying, yes, here's a video, have your doctors look at it, but if you also want to use it for an educational video, have at it. So that's my hope, that we can get, you know, definitely a large library. And, you know, we're going to do things in a way too, where families are like, you know, I want to participate, but, you know, I really don't want my child's video being seen everywhere. You know, we're going to have that delineated, just to say, you know, you don't need to be, you know, involved in a talk 6 months from now, but, you know, we need at least permission to have, you know, 15 or 16 of us look at this to help really name and classify.
So I've got it. So basically anybody who participates, they're going to be showing all these different investigators and doctors and everybody what these symptoms are so that all these people together can start to figure it out, which is really, really important. And then some people may be willing to go ahead and have their videos used to teach other doctors or put on the website or be in a conference talk, but not everybody has to be in the public. But I gotta say, most families of kids with rare disorders, I mean, we want our kids to be cured and we want to help other people get treatments. We want to help everybody with our disorder. So most of the families that I've met are happy to have their child's videos used to teach doctors what Angelman syndrome is all about, or what myoclonus might be, or seizures, or anything like that. So I think this is fantastic. This is great.
Well, the additional part that, what I want to do is also sneak in that question for our movement disorder specialists of, simply of like, hey, if you saw this child in clinic or this adult in clinic, what medicines might you consider? And my hope is that we're going to generate a list of treatments to consider that are things that we aren't doing currently, that are like, oh, that's an interesting thought. Why haven't I tried that before? And again, some of them may be their medicines that we just don't routinely use, that our movement disorder colleagues use more frequently.
So you're basically crowdsourcing new ideas on how to help these people with Angelman syndrome. That's
Exactly.
that's so fantastic, because this has been the older people get with Angelman syndrome, because I mean, when I first learned about Angelman syndrome, there weren't that many people who were older because none of them had been diagnosed yet. Now that people have been diagnosed for 20 years, you have a lot of adults with Angelman syndrome, and a lot of them are getting these terrible tremors and this terrible myoclonus, and we really don't have good ways of treating them. This is so smart to be able to like reach out for expertise to totally different groups of clinicians.
And one other component that came out of this too that we're going to include is, obviously we want videos, but for patients who have been started on a treatment and no longer have abnormal movements, we want them to participate too. Obviously, they wouldn't need to send us videos because hopefully there's nothing to have a video of. But if they participate by sending in information into the survey as well and say, yes, we had abnormal movements and this is what medicine worked, it's also kind of another way of bringing in multiple anecdotes to say, if the same name shows up multiple times, then it may plant the seed to say, this is something we might need to study more formally or more rigorously.
Wow, I love it. Plus it's also really puts a lot of sort of power in the hands of the patient, which is what we're all trying to work on these days, to let patients have a voice. And for people with Angelman syndrome, we have to be their voice. So this is letting families be the voice for the patient and telling you what's going on in their lives. That's really cool.
Well, and that's, every day you're in clinic, you learn from parents, you learn from your patients. And sometimes we just need to figure out a way to amalgamate that knowledge and those stories to say, okay, how can we flip this and study it in a way that may be we can disseminate to everybody.
So let me ask you a couple more things. One is, if that is the case, that all these movement disorder specialists start thinking of these tremors as a movement disorder, would that mean then that Angelman syndrome would sort of be, I don't know, lumped in with Parkinson's disease and Huntington's disease as a movement disorder?
Well, I wouldn't lump them in that way. I think the one clear thing to differentiate is a neurodevelopmental disorder versus a neurodegenerative disorder. where something like Huntington's disease or Parkinson's disease or things that tend to get worse over time. Angelman syndrome is something that, in some aspects of it, and I know like we've discussed before, for a lot of patients, things like seizures get better over time. Some things do improve, other things stabilize and don't worsen over time. But it may just mean that we're saying, here's another challenge associated with Angelman syndrome that may just mean a different area of the brain is affected than the outer part, the cortex, the part that I think of all the time as an epilepsy person.
And so interesting. So thank you so much. That's amazing. And now this group of clinicians that you have also includes, the group that's going to be reviewing the videos. I'm assuming it's including some of the experts like Thiebert who have already been working on this for a while.
It's actually mostly pure pediatric neurologists and adult neurologists who are movement disorder specialists. So of course, I definitely want to get Dr. Thiebert's input along the way. But I also, again, want to, sometimes I think it's helpful to pull in people who don't think about the same things that we think about every day. I know from some other disorders I've worked on that affect multiple organ systems, it can be really interesting to be at a meeting where you're talking about the same disease. I'm a brain person, but you're talking to a kidney person and a lung person and a skin person, and think about how they think about things and what techniques they may use. And so, you can definitely learn things and just, kind of get outside your element a little bit.
Very cool. So thank you so much. I usually ask people in these interviews a little bit about what you like to do for fun. And just so our families can get to know you a little bit as a person. So what do you like to do for fun, Dr. Carson?
So, I'm somewhat jealous that I will say that you have chickens. I don't know if everyone knows that she has chickens. So this summer, my gardening attempts have gotten more fun. So I find it somewhat relaxing to stand out in my backyard and help direct the pumpkins and gourds on what directions they need to grow and what way the vines need to go. So, and then, when I get done with them, I can just chill out and watch the multiple bird feeders and, count birds. So that's what most of the summer has been taken up with.
Do you have tomatoes?
There will be lots of tomatoes. They're still green. We've gone through the green beans already and tried to make some prunes out of plums. So
on purpose?
Yes, I more dehydrated them. It was pretty much a complete fail, but I'm none the worse for it.
That's great. Just so people don't know, we're both sitting in Nashville, Tennessee. We're not in the same place, but we're both in the same city. So that's why. So anyway, it's great to talk to you. I'm really excited about your project. I'm going to try to see if I can get some videos of Lou, because he also does have a little bit of that myoclonus, but it's just at certain small times. So it might be hard for me to get a video, but I think it's a really good project. I'm really excited. I think it's a cool way to think out of the box, and thank you so much for thinking out of the box.
Well, I like to sometimes, for better or worse, and I'm kind of a simple person. So the idea that, we can have families participate in a trial without ever having to leave their home, making videos at the kitchen table or, in the playroom, and just, click a few buttons on a keyboard to get us some information. And that could turn into something that's going to help us teach other people and hopefully identify new drugs. I honestly think it's going to be a lot of fun. So I'm looking forward to getting the data.
Well, thank you so much. And I hope I'll see you soon in the Angelman Clinic. All right.
Same here.
Bye. See you later. Thank you.
Bye.